So I wash my hands. Hi, my name is Phong, and I'll be your therapist for today. To start off, I'm going to ask you a few questions pertaining to your wound. How long ago did this wound happen? Is there any pain? If so, what makes it worse and what makes it better? Have you had any prior treatment to it or for it? Where are you sleeping at night? Like, what's your sleeping positioning? Is your feet elevated or is it hanging off the bed? And lastly, what's your diet like? So looking at your past medical history, do you have any history of diabetes, hypertension, or hyperlipidemia, or PVD? I'm asking this because this can ultimately affect your body from healing due to the lack of oxygen that is circulating in your body. So looking at your wound, the trauma left a significant wound on top of your foot that ultimately got infected. Your second and your third toe show signs of gangrene that would need immediate antibiotics and surgery. Looking at your history of smoking, I have to say this is negatively affecting your healing. Smoking can lead to atherosclerosis, which is just a plaque buildup in your arteries, thus restricting your blood flow. Your wound is progressively getting worse, and you need proper blood flow to encourage the healing. In this case, blood flow is encouraged for that proper healing. I can see that you're taking medications such as Trental, which helps with that blood flow, Lotensins, which will help with the blood pressure or high blood pressure, and Zocor, which will help with the cholesterol and plaque buildup in your arteries. So are you taking them as prescribed? Have you experienced any side effects such as nausea or dizziness? So now I'm going to go through your mobility, occupation, and recreational activities and lifestyle habits. As of now, you use crutches and a wheelchair just to get around. You are able to stand and walk without the assistive device, but only for 5 minutes. You are able to take care of yourself, such as bathing and putting on clothes without any assistant. You used to work as a carpenter before the incident, but have to stop because of your foot. For fun, you like to sit and watch TV. Before the accident, every day after lunch, you go outside and smoke a cigarette. But ever since your accident, your habit has worsened to 2 cigarettes a day. You live in a ranch-style house with your son that comes home from college to check on you. You state that you tend to order out because it's easier and quicker. So the main goal now is just to get your blood moving. So to get your foot back into its normal functioning. To do this, we must aim for a more active lifestyle. Take, for example, just getting up and just walking and standing for just 1 minute every day for the first week, and continue to progress the duration. You can do regular exercise, but within the limits of your pain and tolerance, of course. Make sure you are taking your medication and applying your wound dressing, but also examining your feet daily for increased broken skin, blisters, swelling, or redness, and then reporting if these symptoms are worsening. I encourage you to start cooking and meal prepping healthier food options and quit smoking. These factors will help your wound to heal properly so that you can get back to your job and do what you love or be more active. Now I'll be conducting a system review. I'll be testing your blood pressure, heart rate, and respiration rate. I will also ask you a series of questions to check if you are alert and oriented. I will also do a musculoskeletal assessment to assess the range of motion and strength of your injured foot. Based on the results, you are alert and oriented. Your blood pressure and respiration rate are both high, and your pulse on your injured foot is pretty faint. This can due to the lack of circulation that you are having. You have lost sensation down to your second and third toe. This is making your affected foot more significantly weaker and lacking the range of motion. Also, your skin shows signs of necrosis. So all these problems can get better over time. So let's look at your wound. The location of your wound is on the dorsal aspect of the forefoot that spread and caused gangrene to the second and third toe. So let's measure the wound. So lengthwise, it's about 8.5. And to measure the width, I'm just gonna go perpendicular to it. Up to about 4.5. So 8.5 by 4.5 centimeter square. So looking at the bed of your wound, it's yellow, brown, and black. It's non-granulating and it's about 60% slough and 40% eschar that needs to be debrided. The edge of the wound is fairly large punch out appearance wound with a well-defined circular edge. The peri wound is smooth, firm, but cold. It's cold due to the lack of circulation into your foot. However, there's a new epithelial tissue formation on the ring of the wound. The appearance is shiny pink. So there is minimal seropurulent drainage when the dressing was removed. The color was yellow because of the bacteria in the drainage. And based on my findings, I can conclude that you have an arterial ulcer.